Research shows Black adults have a higher risk of Alzheimer's disease, and yet there's a racial disparity in clinical research trials. Well, now a new study aims to further research and development treatment. Joining us now, Dr. Doris Molina-Henry. She's the Assistant Professor of Research Neurology at USC's Keck School of Medicine. Thank you so much for joining us.
Thank you for having me, Len. It's a pleasure to be here.
Absolutely. And tell us about Alzheimer's disease in Black adults. How much more likely are they to develop the disease, and are the symptoms typically more severe?
That is correct. They are more likely to develop the disease. As a matter of fact, they're twice as likely as whites to develop the disease. The disease also ends up being more severe. But in addition to that, note that Black individuals tend to be diagnosed are less likely to be diagnosed.
And are Black patients typically being diagnosed with the disease at a more advanced stage compared to other populations?
That is possible. Absolutely, it is possible. And that's potentially because they do not know that they have the disease or are hesitant to be seen and to access care.
Let's talk about the why. Why are Black people more likely to develop Alzheimer's?
I think there's a number of factors that underlie that disproportionate presentation. These can be associated to family history, but they're also associated to exposures. They're associated to social factors, systemic factors. In essence, it's really not necessarily the physiology that makes us different. It's potentially our lifestyle and some of the challenges that have positioned us in a place where we may not have as much access to care to be proactive about brain health.
And why are they so underrepresented in clinical trials? And how important is it that they are properly represented?
Yes, so that's an excellent question. There's a myriad of reasons, and some of that is that distrust of the medical institution, the academic institution. There's also hesitancy in accessing care or finding out that you may have Alzheimer's disease. Sometimes it's not knowing family history or genetic testing, so that there's a number of factors that can contribute to even considering participating in a trial. Oftentimes people don't think that that's necessarily created for them, or that they're included or need to be included in these. But I think it's important to change that narrative, and it's really important to consider the value and the need for Black participants in clinical trials. When you think of medications, they go through this very rigorous approval process before they're out on the market, before we can access them when we need them. And that rigorous testing is part of it's what clinical trials do. Clinical trials like the AHEAD study are important because they're looking to not just evaluate a medication, but evaluate a medication before individuals even begin to present symptoms.
Let's dive more into that now, that AHEAD study, that new research. Tell us more about what it is and what participants can expect.
Yes, AHEAD is a study that aims to evaluate or test an investigational treatment that we hope will prevent Alzheimer's disease. And what is unique about the study is that it enrolls individuals 55 years young. So we're looking at individuals at much younger ages, between the ages of 55 and 80. And what's promising about that is that we can begin to tap into preventing the disease before individuals begin to even display signs of changes in memory or changes in thinking. So we're really trying to approach it in a way that people may not even have to experience the devastation of this disease.
And before we get more into prevention, why is the rate of Alzheimer's disease increasing?
Well, the rate of Alzheimer's disease continues to increase, and that may be associated to a number of people not being diagnosed early. I think that there could be a number of factors associated to that. We have more individuals getting older, and that's the number one risk factor for Alzheimer's disease. As we age, it's possible that it is not possible, it is actual that our risk increases. And what we can do is prevent or mitigate that risk as much as possible when we have the time to do it. If we start thinking about this disease 20 years early, it is very possible that we might get to a place where we can prevent it from happening.
That would be ideal. It is one of the most heartbreaking diseases when you see families go through this. So yeah, what can people do now to lower their risk of getting Alzheimer's?
Yes, and there's a number of things that have been discussed and are being investigated: lifestyle changes, improving your eating, exercising, but we still need to know more about all of these different avenues, including potential treatments that might prevent it. And so, one of the things that I highly recommend that people do is to take a step forward and explore clinical trials. Look at the AHEAD study. Go to our website, aheadstudy.org. Look at what the study entails. See if you're eligible. Answer a few quick questions. Take a simple blood test. And this might give you information related to your risk. If you're eligible to participate in the study, you have a phenomenal opportunity to be a part of developing a treatment that might protect individuals in your family, individuals in your community, and in the nation as a whole.
And what's the timeline for folks getting signed up for the study?
Well, our enrollment is ongoing at this time, so we are still working towards reaching our goal. We're aiming for over 1,000 participants. So we really, our call now is in response to our commitment to ensuring that there is representation from different groups, particularly African American groups. As we celebrate Black History Month, it's really important to highlight the value and the importance of being a part of things like this, being a part of finding solutions for the future, and changing this disproportionate presentation of diseases like this one.
Yeah.
So I think it's extremely important to keep that in mind.
Absolutely. Let's give that website one more time.
Yes, that's aheadstudy.org. And if you prefer, you can also reach us at 1-800-AHEAD-STUDY. 1-800-AHEAD-70.
All right, Dr. Doris Molina-Henry, thank you so much. This is so vital that we talk about this and get these families some help and get ahead of this.
Yes.
We appreciate it.
Thank you. Thank you for the opportunity.